In this lecture, I will discuss about the stroke rehabilitation exercises. First, we will discuss what is stroke. Stroke is also called cerebrovascular accident. It is the brain attack is and it causes the loss of brain function due to disturbance in the blood supply to the brain. There are two causes that disturb the brain blood supply. The first is the ischemia. There is loss of blood flow due to any clot formation in the artery. And the second cause is the hemorrhage due to the rupture of the artery. Affected area of the brain cannot function normally, which might result in an ability to move one or more limbs depend upon the which brain tissues involved. Failure to understand and formulate speech, vision impairment is also a symptom of stroke. This is the stroke I will discuss. The rehabilitation exercises we do in the stroke. First is the passive range of motion. It is an important technique to maintain flexible joints and prevent joint contractures. First, we go for passive range of motion. When performing passive range of motion on a stroke patient with limited range of motion, exercises would only be done in a pain-free range. If the patient feel any kind of pain, we stop exercises. Perform passive range of exercises, passive range of motion slowly, and should be the patient available movement or range of motion in which there is no pain felt by the patient. Never force movement if you feel any kind of resistance or increased pain. These are the passive range of motion exercises that we can perform slowly and gently. Next, we have active assisted range of motion. When the patient successful in performing passive range of motion, we go for active assisted range of motion with the help of physiotherapist or any specialist. Active assisted range of motion is helpful in strengthening a limb that does not yet have full range of motion, but we can assist the range of motion. The patient partially move their limb and the therapist assists them in the movement. This is also performed slowly and gently, and the patient range of motion improves. Next, we go for active range of motion. When the patient achieves active assistive range of motion, we can go for further progression, that is active range of motion. Many stroke patients with movement on the weak side may not be strong enough to add resistance. So we go for first active range of motion. It helps to promote joint flexibility, strengthening, and increase muscle endurance. When we perform repeatedly active range of motion, then the muscle endurance increase. Active range of motion. Strengthening of resistance training. When patient successful in all three ranges, we can go for strengthening. Stroke rehab exercises often consist of strengthening activities that involve moving a body part that is weak again against the resistance. This type of exercises will also perform gradually but increase the progression with the passage of time. When we see the patient improves, overload the muscles so that they will get stronger. Strengthening goal is to build the muscle strength and get them stronger. Then we go for stretching exercises. Muscle often become tight or have tone after a stroke because in the stroke condition muscle get tight. Stretching on a regular basis can help prevent the joint contracture and muscle shortening. When we have muscle shortening, we go for stretching. Weight bearing exercises can help reduce excessive tone. In the stroke patient, there is a problem with the patient have excessive tone. So Weight bearing is very important and strengthen the weak muscles. Weight bearing also have prevent bone loss. When there is no weight bearing, bones become weak. So to prevent bone loss, we go for weight bearing exercises. Patient have a balance issue, so we go for balance exercises after weight bearing. Sitting, standing balance is also very important so that patient perform activity of daily living. Sitting balance exercises focus on strengthening the core or trunk muscles. Standing balance exercises will help to improve a patient's ability to stand as well as walk or perform activities without losing a balance. If patient lose balance, patient can fall. So standing, sitting and the standing balance is also very important so that patient can perform his activity of daily living independently. Fine motor skills. This is the fifth, this is the sixth, seventh, and we have eighth goal, that is fine motor skills. It is important for picking any object, feeding oneself, buttoning clothes, writing, and many other activities so that patient have fine motor skills. Fine motor exercises help a patient to improve his use of a hand or manipulating small objects. Because patient one or half limb is affected, so his motor activity is also affected. So we go for fine motor skills enhancement. In this lecture, I will discuss the stroke rehabilitation exercises. I hope so you like this video. Thank you.